I'm Matt Sydes, and I'm the trial statistician for radicals. Over the next few minutes, I'm going to run through with you the design and the rationale behind the trial. Radicals is an efficiently designed trial. It's aiming to address the two most important questions for men who've had a radical prostatectomy for prostate cancer, namely the need for and the timing of post-operative radiotherapy and the use and duration of hormone therapy if and when post-operative radiotherapy is given. Currently, there is variation in practice with regard to the use of these treatments. The first randomization is the radiotherapy timing randomization. This is for men where there's post-operative uncertainty about the need for immediate radiotherapy. So men who join this randomization are randomized between immediate radiotherapy and to follow a salvage radiotherapy policy, where radiotherapy will be given for PSA failure. The second randomization is a hormone duration randomization, and this is for any man starting post-operative radiotherapy, whether that's with immediate radiotherapy or salvage radiotherapy. Men are randomized to receive radiotherapy alone, no hormone therapy, or radiotherapy with short-term hormone therapy, that's 6 months of hormone therapy, or radiotherapy with long-term hormone therapy, that's 2 years of hormone therapy. When we put these two randomizations together, we get the overall trial schema, which looks rather complicated. So let's build this up. We start off with the radical prostatectomy, and afterwards we assess the need. Is there a need for immediate post-operative radiotherapy? If the answer is yes, which it might be for a small number of men, then immediate radiotherapy can be given, and the man can join the hormone duration randomization, where they be randomized between the 3 hormone therapy options. He then enter trial follow-up phase and be assessed for all of the trial outcome measures. A larger group of men will not likely need post-operative radiotherapy. They would follow a salvage radiotherapy policy and they'd be monitored off trial. We should bear in mind that there are many men who've had radical prostatectomies over the past few months or even years who are effectively following a salvage radiotherapy policy at the moment and who could join radicals at the right time. Now for these men, if there's no rise in PSA, then they would never join the trial. But should their PSA start to rise and they're considered for post-operative radiotherapy, they can join the hormone duration randomization, where they will be randomized between the 3 trial arms. They would then be assessed for all of the outcome measures during follow-up. This is the same randomization that the immediate radiotherapy men joined. It's just separated in time. The final group of men is those where we're uncertain about the need for post-operative radiotherapy. These men can join the radiotherapy timing randomization, where they be allocated to immediate radiotherapy or a salvage radiotherapy policy. Men who draw immediate radiotherapy would also be entered into the hormone duration randomization at the same time. This is a simultaneous randomization, so the patient only consents once. Patients then would be followed up for all of the trial outcome measures. Men who are allocated to follow a salvage radiotherapy policy will be monitored on trial, and if their PSA rises, they could join the hormone duration randomization at that point. These two randomizations are separated in time, perhaps by months, perhaps by years, and so the patient needs to reconsent before joining the hormone duration randomization. These patients would then be assessed for all the same trial outcome measures in the same way. There are some men who are allocated to follow a salvage radiotherapy policy as part of the radiotherapy timing randomization whose PSA will not rise, but they should still be monitored on the trial for all of the trial outcome measures so that they can be used in the analyses of the radiotherapy timing randomization. And back in the other groups, we see the overall trial schema. I hope this is clearer to you now. Which patients should join the radiotherapy timing randomization is up to you. The eligibility for this is quite permissive. We've provided a guidance diagram which says the patients that we think should likely be considered to be uncertain for the use of immediate radiotherapy, and so whom are suitable for this randomization. However, the suitability for this randomization is really down to the doctor and the patient. Ideally, we would like all men who join the hormone duration randomization to be randomized between the 3 trial arms. But, given that 3-arm randomizations can be difficult at times, and there may be situations where the doctor or the patient does not particularly want to be randomized against a long-term hormone therapy arm or the no hormone therapy arm, it's permissible to be randomized in a 2-way comparison, at least during the pilot phase. However, we would strongly encourage people to enter the 3-way randomization, if possible, as this is the most efficient randomization for the trial. The primary outcome measure of the trial is disease-specific survival, which is death after prostate cancer progression. The main time point of interest is after 10 years. The secondary outcome measures are listed here. Radicals is a large trial. The radiotherapy timing randomization requires just over 2,500 patients to compare immediate and salvage radiotherapy. For the hormone duration randomization, we need just shy of 2,000 patients to compare no hormone therapy with short-term hormone therapy, and just under 2,000 patients to compare no hormone therapy with long-term hormone therapy. If all patients are randomized in a 3-way comparison, we need a little under 3,000 patients to join the hormone duration randomization. Patients who join the 2-way randomization will contribute to the appropriate pairwise comparisons, but the number will be inflated. The short-term and long-term hormone therapy arms will be compared if they show an advantage over the no hormone therapy arm. We cannot know how many patients will join one randomization, how many will join both, and we don't yet know how many patients will join the 3-way randomization and how many may join only a 2-way randomization. So it's very difficult to estimate the total number of patients that will be required for radicals, but we're estimating that it will be at least 4,000 patients. In the UK and Canada, where the trial will run, there are at least 12,000 radical prostatectomies performed each year, and this number is increasing. So to recruit 4,000 patients over a 5-year period seems very achievable. So the trial schema. We admit it looks complicated, but we hope this is clearer to you now. We've tried very hard through radicals to make this the most complicated part of the trial. Everything else from here we hope will be simple. If you have any questions, or there are any aspects of radicals you would like to discuss with us, please do contact us. Here are the contact details. We look forward to hearing from you.